In the United States, HIV/AIDS is something we learn about in health class, but the reality is we probably don't know anyone with the infection. In less fortunate countries, there is little to no medical care given, thus leaving children without parents. There are 6 high-burden HIV countries in Africa. The one I want to focus on is Kenya. I'm going to explain why this topic is so relevant in the area and how to help slow the spread and take care of those infected. Our goal in this presentation is how to reduce the spread of HIV and slow death rates in the area. Kenya has a whopping 1.6 million people living with HIV. There's a 7.6 prevalency rate with women and a 5.6 prevalency rate with men. As you can see in the map, a lot of the prevalency is within the western states, and as you move east, you can tell that it slowly decreases. This is a huge problem for the country because not only is the disease killing the parents of so many children, but it's also being passed down to their children. There are 2.5 million orphans in the country at this time. Out of this statistic, 48% have been orphaned due to HIV-related cases. To begin the process of slowing the spread, we need to implement a health education program in all schools. This only solves part of the problem because the education system is failing to reach a lot of families due to financial issues and HIV-related issues. In order to reach these families, we have to enhance a few other things in the health system, which brings me to our next step. The desired state would be to reduce heavy prevalency in areas. This is seen in the geographic map where there is a great lack of medical care. To prevent further spread, we need these health clinics in the areas. These health clinics should give out condoms to those people. As a recent study done by PubMed said, out of 75% of people who engaged in intercourse, only 20% used a condom. If people were educated on the safety that comes with condoms, they would protect their families more. In the chart below is the statistics we want to cut down and solve. As you can see, this is not just an issue in Kenya. These steps can also be taken in other countries. But by supporting the people through health education and medically, we can cut down on the loss of life and prevent it from spreading. The last thing we want to do is have this disease spiral further out of control. If we allow HIV to spread, the condition and the gap of the rich and poor will continue to increase, causing people who really need that medical care not to receive it. In conclusion, we need to create awareness through education systems. This will create generations who are wary of the fact that this disease not only affects them but their families. We need to give people who have the disease medical care needed to suppress their symptoms and hopefully allow them to live a much longer life. Not only do we want to suppress their symptoms, but provide them with the means, like condoms, to protect themselves from any of these nasty diseases in future relations. Thank you for listening to my presentation. Here are my citations.